at the time of the initial diagnosis, something like 40 to 70% of women already have cancer stem cells in their bones.
Really?
In their bones. It's not detectable in any testing we could do. This is very sophisticated science. It's basically just available in a research lab setting at this point. Dr. Wicha from Northwestern was talking about this. I listened to a YouTube video by him about this very topic. So it's out there. It's in the literature. It's well known that women post breast cancer, if they don't have any other problems that they die from, otherwise will end up getting Mets. So how do you take care of those Mets? How do you prevent those from happening? So we're talking about treating and helping people who have an existing cancer diagnosis, right, who are going through all the things they need to do to go through that existing cancer diagnosis. What about those people before 10 years ago, 5 years ago, or even longer, who in quotes were cured as far as the medical system is concerned? A cure as far as the medical system is concerned means that we have nothing more to give you.
We're out of options for you.
Yeah. We're out of options for you with the tools that we have in our toolbox. So what I'm saying is that what happens is that inflammation in the body, the lack of energy in the body, allows those stem cells to activate, turn on, and become localized cancer cells.
So the body operates at a certain hertz, and then does disease or cancer have its own? How does that work?
Yeah, well, every molecule has its own hertz.
Okay.
Every molecule. So red, yellow, green, blue, sodium, chloride, magnesium, every molecule. We can study what's going on a planet doing something called spectroscopy, because we analyze the minerals in that planet based on their wave patterns. To try to focus on frequency is not worth it.
Okay.
Because it's too complicated. We're not smart enough to be able to know exactly how to tune it. A cell has an incredible number of molecules in it. An individual healthy cell has an incredible number of molecules in it. A cancer cell is probably less capable than a regular cell, but its genetic machinery has now been turned on in an adverse way, in a negative way, if you want to call it that. Yeah. So you can't do by frequency. The important thing, again, is the intensity. The intensity is the critical factor. If you give the body a stimulus that allows the body to make more energy, the body will take care of business. We're not smart enough to figure that out.
Okay.
Just give the body the support it needs. All the things we talked about before: the physical, the emotional, the cognitive, etc., spiritual, and then this adding the energy pattern to the body. Then that causes the body to be healthier.
So when we have a cancer diagnosis and we're going through whatever treatments that we decide, whether it be conventional, natural, integrative, despite all of that, part of the recovery process that we need to be engaged in would be to support our energy levels, regardless of what we're doing.
Well, I've been working with magnetic fields for 30 years. In 30 years as a family physician and a holistic physician now, everybody should have a magnetic system, because who doesn't have entropy? Who isn't breaking down? So we don't know what we need at any given time. But even if you eat the right foods, they often need to be helped to be activated in the body. In other words, you could take ATP, but that doesn't mean that ATP that you take is going to work. You can take magnesium, you can take sodium, you can take Mariva. You don't know whether it's going to work. But what you're doing then is, by optimizing the body, it allows nutrients to get into the cells better. It allows waste to get out of the cells better. So all nutrition is amplified and benefited by magnetic field therapy. Medications are amplified and benefited by magnetic therapy. Chemotherapy has been found to be twice as effective when people are using magnetic fields at the same time, and they're less likely to have side effects. If you're going to have surgery, one of the things that happens with surgery is that you decrease NK cells in the body, natural killer cells. That stress decreases NK cells. What are NK cells used for? To kill cancer cells, right? So the Chinese have actually discovered when you do acupuncture treatments, you stimulate NK cell activity. Well, magnetic fields do the same thing. They stimulate the NK cells to optimize. So again, if you're doing the magnetic therapy, you're giving yourself the benefit. It allows medicine to work better, allows nutrition to work better, makes your sleep work better. It just makes everything work better generally.
So even for somebody who's dealing with anxiety, stress, depression, some type of PTSD, and receiving a cancer diagnosis in itself is a form of PTSD for most patients.
Absolutely, I agree.
So incorporating this to help with the emotional aspect, I know a lot of people have a hard time grasping, how does this help emotionally? How does this help on the mind level of the mind-body connection? And just as you explained earlier, I just want to really kind of tie this back or loop it back in. But those emotions that we experience all have energy. Those are energy. It's energy in motion, and that's downloading into the system.
It's emotion.
Emotion, yeah. So that is severely impacting our overall health. So when we're providing the energy back to the system, back to the cell, everything's going to function more effectively.
Everything. The biochemistry functions better. So when you're not happy, it changes GABA levels, changes dopamine levels, changes serotonin levels. And when you do magnetic field therapy, all those cells that are producing all those molecules are now humming, and they're going to produce better. So again, it will make you a little bit more resistant to the dip into depression. So if your cells are optimized already, then you may still feel sadness, and you should.
Yeah.
We're not going to be zombies. We don't be flat. We don't want to not feel happy, and we don't want to not feel sad. We need to be able to operate in the right band, the right way.
Feel all the feels, right? Yeah.
Feel everything. And the magnetic fields again optimize everything. Everything gets a chance to be better.
Yeah. So the healing's in the feeling, right?
It is. It absolutely is.
It is. So, not to get too far off topic, but I do want to touch on this just a little bit. We have been, a lot of clients are reporting that in incorporating their cannabinoid therapy by supporting their endocannabinoid system alongside with their PEMF therapy, they're noticing significant improvement in their health. And that is because the electromagnetic fields are something, it's a natural. So it's not like taking ashwagandha or schizandra berries or something that is an outside source or herb or something that we're trying to create or stimulate change in the body. It's something that the body naturally is supposed to already have. So this is everything in our atmosphere is dealing with electromagnetic fields.
Well, let's go to that point about schizandra, or it doesn't matter, never pick whatever molecule you want. All the good, helpful molecules for cancer management. A healthy cell will use it better. An unhealthy cell may need it and may work better. But if you can optimize the health of that cell and then you give it schizandra, it's going to work even better. So the magnetic therapy is going to make everything work better. And by the way, PEMFs have been found to actually stimulate the endocannabinoid system all by themselves.
Yep.
So when you're using CBD along with PEMF therapy, you're amplifying those benefits. But it's not just endocannabinoids. There are the opioid receptors as well, which are still very important for us. And then all the other receptors. I mentioned the adenosine receptor for ATP production and inflammation reduction. So PEMFs don't care. You can't decide what the PEMF is going to do in your body. You can't dial it or tune it. The body's going to take, you're giving a nondescript, a generalized stimulus to the body, and the body will use it the way it needs to and wants to. And what happens is that it's going to do that initially for the things that are the easiest to move and shift. And then you start to change physiologic function. As you shift the body that way into a physiologic change, but it's more or less constant and more or less reliable, then the body does repair. So this is not a one-time thing. You can't go to a doctor's office to do treatment. You've got to own your own system in order to keep up the stimulation. People ask me, how much treatment do you need to do? And I say, how much does your body need? right? I can't tell you how much your body needs. You'll figure that out by trial and error, by using it and seeing what you need. The more in disrepair you are, as you were talking about, the more you have to recover, the more you have to come back to health. That takes a lot longer than if somebody's just has a sneeze. They don't have a cold yet, but they have a sneeze. That's a lot easier to get rid of than a cold that's completely settled in. We should talk, before we go, we should talk about the BEMER. I'm going to talk about the BEMER.
Oh, go ahead.
And there may be people who are listening who are not going to be happy with this. And there may be people who are listening who are BEMER distributors, and they're not going to be happy about this. The BEMER is about 1 Gauss. Okay, I'll give you 2 Gauss, but it's very, very low intensity. I said the adenosine receptor needs 15 Gauss, and that's just at the surface.
Sure.
That's not deep in the body. So you need the right magnetic field therapy system to be able to provide you enough benefit deeper into the body. So these very low intensity systems, I used to sell them and promote them and support them, but I stopped doing that because they cost a lot, and for what you end up paying, you get almost nothing in terms of magnetic field intensity. Now, people say they feel better. Yes, because they're stimulating the acupuncture points and meridians that are very superficial in the body. There's no problem, no harm in that. But you could do that without spending $6,000.
Right. So would that be comparable to what people talk about when they say earthing and grounding and being out in nature?
Yeah, earthing and grounding are very similar concepts. So that's another way that we used to do acupuncture when we were walking on the earth with bare feet and laying down on the ground, right? Or hugging trees. Right. So that's such a low level. And that's better in a sense for just sort of general maintenance. It's just like doing whether you need it or not, go get an acupuncture treatment. You'll feel better. Right? It's always going to make you feel better no matter what, but it's not enough.
So that's just part of being healthy. That's just part of daily life, but it's not enough.
That's health maintenance.
Right. You can't recover from walking barefoot in the woods, right?
No, you can't. There's not enough juice there to do that. And that's why I work with these high intensity magnetic fields. So as a physician, I'm dealing with significant problems. And those significant problems need significant solutions. And so that's why people need to get the most appropriate solution for their problem. And I recommend people either buy my book, which is called Power Tools for Health, or go to the website, drpawluk.com. And there's a ton of information there.
So who would not benefit?
Who shouldn't do magnetic field therapy? Snails benefit. Plants benefit. Pets benefit. Racing horses benefit. It doesn't matter what kind of biology you are. You're going to benefit from magnetic field therapy. So the bigger question is who should not be using magnetic field therapy? And there's a very few. We always talk about pregnancy because we don't have really clear science to say it's safe. We say the same thing about our drugs and even our nutritionals. We don't know how safe they are for pregnancy because the research hasn't been done. But put that aside, and I know plenty of women who are pregnant who would do phenomenally well with magnetic field therapy. So at least we have to put that disclaimer in there to begin with. Anybody with a transplant should not be doing magnetic field therapy. If you have active bleeding going on, the bleeding needs to be stopped. You probably shouldn't be doing magnetic therapy because magnetic therapy actually causes platelets not to stick together. And when you're bleeding, you have a wound, you need the platelets to close that wound off to stop the bleeding. So magnetic field therapy may inhibit that bleeding basically to the same extent that aspirin does. It has the same level of action that aspirin does.
Which is pretty impressive.
Which is pretty impressive. You have to be careful with magnetic fields too if you're really what I call hot. If your immune system is really on fire, you have to be really careful. You do want to decrease the inflammation, but you have to do it very gently. I call it going low and slow because you can overwhelm the system with too much stimulation. All of a sudden, you're telling the body to do more than it's capable of doing. Magnetic fields don't generally cause problems. They reveal problems.
Oh, okay.
Because it's a nondescript stimulus. It's just passing through.
Sure.
It's waking things up. But if you're waking up too many cells in the body, your arms, your legs, and so on, and now the rest of your body is being flooded with all this energy, and it wants to do stuff, and other parts of you can't do it. So therefore, you have to go low and slow.
Okay, so would that be what we would refer to as maybe a Herxheimer reaction?
Well, that's one aspect of a Herxheimer reaction. It's actually not a Herxheimer reaction. It's really more of an aggravation.
Okay. Okay.
Okay. And the only other thing would be, again, when you have a very hot, which is also related to this, when you have a very hot autoimmune process going on, you have to be careful. But there are so few limitations. But even there, you just have to be careful. It's not a negative. Not that you shouldn't do it.
Right.
You just have to be cautious.
Caution.
Yeah. Be respectful of your body. Listen to your body and see what you can do and should do.
The last thing I want to touch on is the difference between dirty EMFs and pulsed electromagnetic field. How can we, this 5G and all of this Wi-Fi, and now with the coronavirus going on and all these kids being forced to go at home, looking into online school, everybody's walking around with a phone. We're being bombarded with all of this dirty electromagnetic field energy that's disrupting us at a cellular level.
Yeah.
It's destroying us.
Well, and especially a healthy, you said this at the beginning, healthy trees don't get bugs, right? A healthy body is probably going to largely ignore these environmental EMFs.
Okay.
But if you have any significant health problems, then all these environmental EMFs are a challenge to the body. They're challenging the body indiscriminately and making the body defend itself. That's why they're a problem. But they're microwaves, all microwaves. Dirty electricity is partially microwaves, but it's a bunch of other stuff as well. But they're irritating, and we're constantly surrounded by this dirty electricity. The lights are producing dirty electricity. Our outlets, our electrical instruments in our bodies, in our houses, in our homes, in our offices, sitting right next to us, are producing some of these unwanted frequencies. Right. But the most problematic, as you said, 5G, the most problematic is the microwaves. What do we use a microwave oven for?
To cook.
To cook.
Yeah.
So your cell phone at your head is cooking your brain.
In your pocket. Right? Yeah.
And even in your pocket.
Yeah.
If it's next to your body, it's cooking you. And so that's what it's doing, is making genetic changes in your tissues and putting another major stressor on your body. Now, again, that's the negative magnetic fields, because they're absorbed by the tissues, and we don't want them to be absorbed. The beauty of ELF, extremely low frequency magnetic fields, as opposed to high frequency magnetic fields, is they pass right on through. The other ones get absorbed, like our food and our microwave ovens. It absorbs it, and that's why it heats. So the ELFs, as they pass through the body, they're stimulating the body to be more alert, more active, optimized. And what they do then is they cause resistance. You're not blocking those environmental fields, but you're making the body healthy. We know with magnetic field therapy that healthy cells ignore the magnetic field.
So we can support damage done or the chaos that's been created by the cooking of the cells,
right?
The ELFs.
Yes. So if the cell is already optimized, that ELF is going to be absorbed, but the cell says, unless it's a really high intensity ELF, I mean, you could burn the tissues. We do that on purpose in certain cases surgically, right? But no, the EMFs that are around us are relatively low intensity, unless it's sitting right next to your ear, or you got a 5G transmitter of 400 feet or 500 feet away from you. Then you're going to get a lot higher exposure. Most of us are not exposed to extremely high intensity or really close, so our heads are not in our body's not in the microwave oven, right? So we're just getting these sort of weaker exposures continuously, and the problem is it's continuous. And when you're doing magnetic field therapy on a regular basis, daily, at least twice a day, I recommend twice a day, then you're optimizing the functions of the cells that will resist even those small amounts of influence. But when you have a disease, then when you have a problem like cancer, you got to get rid of that stuff. You got to mitigate as much as possible from your environment. So you decrease further demands on your immune system, further demands on your body to have to respond.
So good for the kids then too, because their bodies are growing at rapid speeds. The cells are dividing and multiplying very quickly, so they're
Yeah.
more sensitive.
Even more risk of converting cells, rapidly growing cells, into the wrong kinds of cells.
Yeah,
Yes.
okay. So this is a good preventative measure to incorporate for our children as well.
Absolutely.
Yeah. So
Yeah.
not only does this support the whole being of somebody who's dealing with a cancer diagnosis, but this is ideal as a preventative measure. Just
Absolutely. No, absolutely. That's why I say everybody should own a system, no matter what, right?
yeah.
So then you have it when you need it, but you also have it if an airplane falls on your head. Then if you already own a system, then you're kind of ahead of the game already.
You're all set and ready to go.
Yeah.
Yeah. Yeah. And your website can help them with that.
A lot of that, and we do provide consultations for people who are, pretty serious about magnetic therapy. I don't like doing consultations for people who have not done their own homework.
Yeah.
If they haven't read the book, and you can buy the book for $9
On Amazon or your website?
on Amazon or on our website. You can buy the ebook. Well, on our website, you don't buy the ebook, but you can buy the ebook on Amazon. And of course, the website, as I said, has a ton of information. So you can educate yourself, far and wide about magnetic field therapy. If you do that and you still think that, yes, this may be a solution for you and can help you with your cancer process, then you can give us a call and set up a consultation. And we can guide you to the appropriate system for you. So there is no such thing as one size fits all. This is, again, another reason I have a problem with the Beamer. They claim it's all you will ever need, and 8 minutes is all you need. 8 minutes a day. Whoop-de-doo. They don't read my book. They don't want to read my book. They don't want you to read my book.
No, it's superficial. It's not penetrating. It's not
Not at all.
right? Right.
Not at all. Yeah.
Okay.